Today I want to talk to you about gout. I am going to talk about the topic by answering a series of questions. Let's begin. The first question is, what is gout? Next, what is the cause of gout? Then, who is affected by gout? And how is gout diagnosed? Next, what is gout a flare-up? Next, which food and medication should a person with gout avoid? And the last question is, what is the treatment for gout? Let's begin. Question 1. What is gout? Gout is severe pain, usually in a single joint. This pain is due to inflammation. Question 2. What is the cause of gout? Gout is caused by uric acid crystals in the synovial fluid of the joint. In hyperuricemia, uric acid crystals leave the serum and get into the synovial fluid of the joint. Once there, the crystals are coated by IgG antibodies. These coated crystals are then phagocytized by polymorphonuclear neutrophils. During the process of ingesting these coated crystals, the neutrophils release both inflammatory mediators and proteolytic enzymes. It is the effect of the inflammatory mediators and proteolytic enzymes that lead to the significant inflammation and pain in the joint. Question number 3. Who is affected by gout? Gout affects men more than women. In fact, women are not affected until after menopause. Most men are over 30 years when they get their first attack. Usually, the pain is so severe that it awakes them from sleep. The elbow, wrist, finger, knee, ankle, midfoot, and great toe are common areas affected. However, the great toe is most often affected, and when it is known as podagra. Usually, the affected area is painful, tender, red, hot, and swollen. How is gout diagnosed? Hyperuricemia is not gout, but hyperuricemia can lead to gout if crystals leave the serum and populate the synovial fluid. Before I talk about how it is diagnosed, let me mention the 2 ways by which uric acid can be elevated. First, uric acid can be elevated by increased production. And secondly, it can be elevated by under-excretion by the kidneys. Decreased excretion by the kidneys account for 90% of hyperuricemia cases. The diagnosis is made when the synovial fluid from the joint aspiration is examined under a polarized microscope. Usually, needle-shaped and negatively birefringent urate crystals appear in the synovial fluid. This is the only way to make a definitive diagnosis of gout. Keep in mind that serum uric acid is not helpful in making the diagnosis, but it may be normal during gouty flare-up. Question 5. What is a gouty flare-up? A gouty flare-up is the sudden onset of severe pain over the affected joint. The flare-up may be due to cold temperature, dehydration, emotional or physical stress, excess alcohol intake, and starvation. Red meat and seafood have also been linked to gout. Take a look at this radiograph. Notice bone is missing from the distal first metatarsal bone. This is called punched out erosion and suggests advanced disease. Advanced gout can also manifest as tophi, which are aggregation of urate crystals. Common locations of tophi include extensor surface of the forearms, elbows, knee, Achilles tendons, and the pinna of the external ear. Here's a picture that depicts gout to the diagnosis, including the negative birefringent crystals. What food or medication should be avoided in gout? Patients with gout should probably avoid excessive red meat, seafood, and alcohol. In addition, they should avoid diuretic medications and aspirin, which increase serum uric acid. Keep in mind that hyperuricemia is not equivalent to gout until there is a buildup of urate crystals in the synovial fluid. What is the treatment for gout? The acute treatment of gout includes NSAIDs, of which indomethacin is traditionally used. Colchicine is used for persons who cannot tolerate or respond to NSAIDs. Even though colchicine is effective, it is less favored because 80% of treated patients develop significant nausea, vomiting, abdominal cramps, and severe diarrhea. Compliance tends to be low due to these side effects. It is contraindicated in renal insufficiency and can cause cytopenia. Oral steroids are used in patients who do not respond to NSAIDs and colchicine. However, there are rheumatologists who use all three medications at the same time in treating acute gout. The last treatment for acute gout, if oral medications are ineffective, is intra-articular injection, and this is only if one joint is involved. The maintenance treatment includes two classes of medication. The first is the uricosuric drugs. These drugs increase excretion of uric acid. If the 24-hour urine uric acid is less than 800 milligrams per dl, then uricosuric drugs such as probenecid and sulfapyrazone may be used if the renal function is normal. They are contraindicated in patients with renal stones. The second class is the xanthine oxidase inhibitors, of which allopurinol is traditionally used. These drugs decrease uric acid synthesis. If the 24-hour urine uric acid is greater than 800 milligrams per dl, this indicates overproduction, and allopurinol may be used once per day. This is important to remember. Allopurinol must never be used in acute gout. It makes it worse. Allopurinol may be used in renal insufficiency, and the most concerning complication is Stevens-Johnson syndrome. Well, thanks for watching. Hard work pays off. At some point, please don't forget to like, share, and subscribe. I wish you well. Good night.